Hi and welcome. We're going to be looking at the active management of the third stage of labor. So, the third stage of labor is from delivery of the baby to delivery of the placenta. And active management of the third stage of labor is a set of practices used to prevent postpartum hemorrhage, that's PPH, and promote uterine contractions after delivery. The key components of active management of third stage of labor include: 1. Administration of uterotonic agents. Give a medication such as oxytocin to stimulate uterine contractions and reduce bleeding. Second is controlled cord traction. Gentle traction on the umbilical cord to help deliver the placenta. Third is uterine massage. Massaging the uterus to promote contractions and reduce bleeding. So, in the active management, you begin with administration of oxytocics such as oxytocin within 1 minute after the delivery of the baby. Second is early clamping of the umbilical cord. And third is controlled cord traction. So, let's move to secondary postpartum hemorrhage. Secondary postpartum hemorrhage is bleeding from the female genital tract 24 hours after delivery and no more than 6 weeks postpartum. Presentation is usually in the second week postpartum. Cause is commonly attributed to retained placental tissue. You give intravenous infusion if necessary. Transfuse blood if necessary, that is, if blood loss is significant. You give oxytocin such as oxytocin. You give therapeutic antibiotics. You arrange for examination under anesthesia and evacuation. Other possible causes of postpartum hemorrhage should be explored. Monitor the vital signs such as heart rate, respiratory rate, and blood pressure. Note that the commonest cause of secondary postpartum hemorrhage is endometritis from retained tissue, usually in the second week postpartum. Endometritis is inflammation of the endometrial lining. It's usually as a result of infection due to the presence of retained placenta tissue or other causes.